Outraged by the incidence of cervical cancer in Ivory Coast, pathologist Mélanie Usher has made prevention her priority. At this market in Abidjan, she encourages women to get screened. Cervical cancer is easy to miss. It's often painless until it reaches an advanced stage.
If you notice spotting when you're 25, but you don't feel anything, you'll probably think, it's nothing serious, I've heard it could be, but I'm not worried. And then 25 years later, you find yourself bleeding.
For a long time, the subject was taboo. Little information was available to women.
It used to be more complicated because people were reluctant to talk about anything related to women's health. But now, women talk about it more openly, so things have gotten better.
In 2020, some 340,000 women worldwide died of cervical cancer. Most lived in poor countries like Ivory Coast. In many cases, the disease can be prevented through early detection. That's why Mélanie Usher offers health screenings. With her NGO, Willick International, she sets up mobile tents at markets or outside hospitals. Early in her career, she saw many women for whom diagnosis came too late.
I was essentially issuing their sentences with my microscope. We saw women at a stage where all we could say was invasive cervical cancer. And usually they were very young women. Eventually I thought, I can't spend my life just making this kind of diagnosis. I wanted to do more.
After training in Malawi, she adopted a method of visual inspection using acetic acid, ordinary vinegar. It's a quick form of screening that requires little equipment and can be performed anywhere. The examination is performed like a regular gynecological consultation. The pathologist wipes the cervix with a cotton swab soaked in acetic acid. The result takes just a minute. If a colour change is visible, that can indicate the presence of cancerous cells. The method is cheap, quick and painless. It's recommended by the WHO for countries where pap smears are not readily available.
We wouldn't be able to do large-scale pap smear screenings. We have to screen 1,000 or 2,000 women, and we can't do that with pap smears. But this method lets us screen many women and get a result for them right away.
This woman is being screened for the first time. After a suspicious spot appears with the acid test, Usher performs additional testing.
This isn't a definite cancer diagnosis, just a color change. Do you understand? There's a color change, that's all. So now we're going to check whether the color is suspicious.
The pathologist performs a second examination with magnification so that she can examine the spot more closely. If caught in time, the condition can be treated before it develops into invasive cervical cancer. In this case, it was a false alarm.
The area is red, but there's no spot.
Everything is carefully recorded. The patient is relieved.
You have to get tested to be sure. I didn't really want to do it, but if I tested positive today, instead of getting seriously ill, I could have been monitored and treated.
Mélanie Usher and her team have been able to screen 45,000 women in the past 7 years. As soon as she sets up her tent, the pathologist invites those women in the area she's screened in the past to stop by. And she ensures that the results of all further screenings are recorded in their medical records.
Everything's fine. In 3 years, we'll do a follow-up test.
Merci beaucoup, madame. Au revoir.
I hope we can continue our work, and I hope that the government will support us in that. I reiterate at every conference that we have teams going out to where the women are.
Mélanie Usher has set up a safe and simple screening program with good results. Expanding the program could make a big difference for women in Ivory Coast.